I am Dr. Shrish Mishra. I am a senior orthopedic surgeon, sports injury specialist, and I am attached with in the Trust Apollo Hospital, New Delhi, and also function from my center, South End Orthopedics Center for Sports Injuries in Greater Class Part 2, New Delhi. So today we are going to talk about sports injuries. I think this part of the orthopedics is not elaborately understood, and in terms of evaluation of the injury, the causes of injury and the treatment of injuries. Not all sports injuries require a treatment as a surgery. Most of the injuries are treated conservatively. They are treated starting from the first evaluation of the injury. Each sports has certain biomechanics and supports certain dynamics which are associated with the injuries. Like in football, the anterior cruciate ligament injury is very common. It is because the dynamics of that sport, it is because the dynamic of the player and how the game goes about it. Similarly, in all the swing sports, it is the shoulder injuries are very common, elbows injuries are very common, and wrist injuries are very common. But the causes of these injuries are very, very different. Whenever you are treating a sports injury, the treatment of a professional sports person and a leisure sports person or a club level sports person is very, very different. The causes are very different, the evaluation is very different, and the treatment is very different. To put it in a very small terms, professional, it is overuse injuries. But in a club level player, it is the poor conditioning and the poor techniques which contribute to the injury. So I have always said that sports injuries are dynamic injuries. Unless you correct the dynamics, that injury is going to reoccur, eventually become a chronic recurrent injury, inamiable to the conservative treatment, and there where the frustration of the player comes in. So the first time the injury has to be handled where the doctor knows the dynamics of your sports. What I mean by dynamics of the sports is how you play that game. Every swing has certain mechanics attached to it. If that mechanics is not rightly followed, leads to a concentration of energy to a particular point, and in coming time that point becomes an injured point, like tennis elbow, shoulder pains like subacromial impingement, wrist pains, ulnar collateral ligament injuries. These are very, very common injuries. I am personally myself a sports person who have played majority of the sports. Right now I am a very low handicapped golf player. So when I handle a golf injuries, it is entirely a different scenario. I make the person swing. I have to know what is the dynamics causing this energy. Fortunately, I am also attached with cricket. Right now, me and my team are handling Afghanistan international team, where we take care of the evaluation of the players and prediction of the injuries. So friends, my bottom line in this short video is that whenever there is any pain following your sports or the pain happening during the sports or after the sports, you can obviously wait for 5-6 days, put in ice, put an anti-inflammatory gel and rest to the part. If it becomes okay, that's okay, and it can happen to anybody. But if your pain is persisting, if you are unable to play, please do not push yourself beyond a certain limit, because that is where you are injuring yourself too much. Consult a sports injury specialist. He will help you in the right evaluation and treatment of that injury. Point of this talk was to enlighten that remember all sports are associated with injuries, so there is nothing to be feared of. Play any sport. Functionality is the prime thing of the life. So play all the sports. Injuries do happen, but if they are treated well, they are cured and you play a better sports. Thank you very much.